Hello, this is Dr. Anil Goody from Fertility Plus London. In today's episode, we're going to look at a striking case that challenges how we interpret ovarian reserve in women on the pill. Long-term combined hormonal contraception is something many of our patients use. Pills, patches, or rings that switch the ovary into a quiet anovulatory state. We know from several studies that this can lower the AMH by about 20 to 30%, and that's what the pill may do on an average, and often reduce the antral follicle count as well. In some women, the numbers look frankly alarming, in the range we associate with severe diminished ovarian reserve. The case reported in the Fertility reports involves exactly this scenario. A young woman, after continuous years of continuous combined hormonal contraception, presented with profoundly low AMH and a very low follicle count, values that most of us would interpret at a high risk for poor ovarian response. If you all saw these numbers, we might be tempted to increase gonadotropin doses and warn her that we are unlikely to obtain meneucide. What happened next is a surprise. After stopping contraception and proceeding to control ovarian stimulation, her ovary did the opposite of what was predicted. She developed a large cohort of follicles and a clear hyperresponse, enough to raise concern about ovarian stimulation syndrome. In simple terms, a very low reserve profile on paper turned out to be a very active ovary once the drug suppression was lifted. This case sits alongside other reports showing a combined hormonal contraceptive related suppression of ovary reserves can make profound and take several months to recover. It adds an important twist. In some women, the danger not only is misleading as poor responders, but also underestimating the risk of overresponse and ovarian hyperstimulation. So, what do we learn? For clinicians, we integrate a contraceptive history into our interpretations of AMH and antral follicle count. Consider a pill-free interval and repeat testing when results are extreme, and approach stimulation cautiously in terms of long-term oral contraceptive users. But for patients, the key message is that if you're on the pill and your AMH is low, that is not the final word on your fertility. You should let your team know what contraception you're on. Thank you for listening, and we'll meet up again.